I want to tell you about Amir because his story is almost exactly the one I hear from Malaysians every single week, and because it has an ending that most people in his situation never reach. Amir was a software developer in Cyberjaya, spending the best part of 10 hours a day at a sit-stand desk that he almost always left in the sitting position, and for 3 years he lived with lower back pain that started as a minor ignorable ache and gradually became something that touched every part of his daily life. The stiffness started as something he noticed when he stood up after a long stretch of focused coding. It eased after a few minutes of walking, and he told himself it was normal, the kind of thing that comes from a desk job. By year 2, it was there every morning when he got out of bed. Getting up from the low sofa in his living room had become something he mentally prepared for before attempting. He tried 3 different massage therapists over those 3 years. Each one gave him 2 or 3 days of genuine relief before the pain returned to precisely where it had been before the session. He invested in an ergonomic chair that measurably improved his sitting posture but did not change the pain pattern. He completed 2 short courses of anti-inflammatory medication from a general practitioner, which suppressed the pain for a few weeks each time until it returned. At 34 years old, he had quietly resigned himself to the idea that this was simply what his body was going to be like from now on. His wife made the physiotherapy appointment on his behalf, partly out of frustration, watching him manage the pain rather than address it. The assessment took 40 minutes. What the physiotherapist found genuinely surprised Amir. The primary driver of his pain was not in his back. His gluteal muscles, the large, powerful muscles that should be providing primary dynamic stabilization for his pelvis and lumbar spine across the entire working day, had essentially switched off. After years of sitting for 10 plus hours daily with the hips in sustained flexion, the neural pathways controlling the glutes had degraded progressively. The activation timing became slower, the strength reduced, and the muscles stopped contributing meaningfully to the stabilization work the lumbar spine depended on them for. His lower back had been performing the job the glutes were supposed to shed, and 3 years of that compensatory overload had produced exactly the chronic, persistent, cycle-dependent pain he was experiencing. The physiotherapist also identified significant thoracic mobility restriction that was forcing his lumbar spine to compensate with excessive movement during tasks as simple as reaching for a coffee mug or turning to look at a second monitor. The treatment plan had 3 specific non-negotiable components: manual therapy for thoracic mobility restoration, restoring the range the mid-back had lost so it could contribute its share of movement, and stop offloading excessively onto the lower back, a structured gluteal activation and progressive strengthening program, beginning with isolated activation cues to rebuild the neural pathway, progressing to single leg loading, then to integrated movements that reflected the demands of his daily life, specific restructuring of his working day, a minimum of 3 minutes of movement every 45 minutes, 2 targeted exercises done at his desk, and a deliberate sitting position change during his daily commute. After 2 sessions, getting out of bed in the morning was noticeably different. After 4, the end-of-day stiffness he had lived with for 3 years had reduced by roughly 60%. After 6 sessions, he was progressing through his home program, and the load distribution through his lumbar spine had measurably changed on clinical reassessment. At 3 months, he described himself as essentially pain-free. He continues 3 maintenance exercises 3 times per week and breaks his sitting every 45 minutes without fail. He has not needed another massage, another anti-inflammatory, or another physiotherapy session since completing his treatment. His story is not unusual in its features: gluteal inhibition from sustained desk sitting, thoracic restriction, compensatory lumbar overload. This combination is one of the most common physiotherapy findings in Malaysian office workers with chronic lower back pain. What is unusual is that he reached the end of it. Most people in his situation never get a proper assessment, continue cycling through temporary relief, and live with the pain as a permanent feature of their working life. The one decision that broke Amir's cycle was not finding a new treatment, it was finding the actual cause and treating that specific thing. His full story and the physiotherapy approach used are in the link in the description,